Welcome back. This is Eric Roden, Doctor of Physical Therapy and Neurology Solutions, and we are here to do a treadmill training. So this is for your high-level patients. Again, always make sure you consult a trainer, physical therapist, occupational therapist before you do anything like this. This is a very high-level movement, takes a lot of coordination skill, so make sure you are careful and probably have a spotter the first time you do it. So this is going to be doing directional changing on the treadmill. The reason why we do this, it's hard sometimes to shift between two distinct tasks. A forward walk, a side shuffle, a backward step, especially at a fixed pace on a treadmill makes it much harder. On regular ground, we tend to be able to control our own cadence. So the treadmill adds a little bit more intensity, a little bit more challenge. So let's begin and a little demo first, and then if you want to go ahead and try one on. Okay, here we go. So this is going to go pretty slow. I'm going to go at a 1 mile an hour pace, so nice and easy. It's going to take a minute to get up and going. So I'm going to start in a forward direction, okay? Now if you need to hold on, that's fine for the added challenge without. Now this is a pretty slow pace. That in and of itself is a challenge because it requires additional single leg stance time. So I have to take a slower weight shift to go forward. So initially, I'm just kind of getting the feel for it. This is maybe after your run, after your cardio, your brain is nice and primed. Now you do some coordination training. So, in a moment, we're just going to switch. And we're going to do a side shuffle. Now that part seems easy. It's not. Now, it's trying to get this pattern. Make sure you are side shuffling towards the front of the treadmill, not the back, otherwise that won't go so well. And you may flux back and forth. So what I recommend is picking a spot on the ground ahead of you and try to stay right in front of that, because a lot of people end up going to the end or they're really far forward. So try to stay right in the middle. And again, you're going to do this 15, 20 steps, or even a full minute. You can time it. And then you're going to switch again. The fun one is backwards. We tend to have that tendency to be on our heels, so being able to shift our weight into our toe more as the treadmill tries to push us backwards is very, very challenging. Some people might get a little lower. That's totally fine. I got a ball out there. This is another added challenge. This is timing. This is sequencing. So I actually get myself closer to the edge, and I pick the ball up, and then I bring myself back. And then I bring myself down, and I bring myself back up. That is very, very high level. Again, do this with a trainer, PT first before you ever try this on your own. And again, we're going to switch. And then I'd switch again. I'm not going to make you see my backside for 20 steps. That's the sequence. It's very simple. Depending on how long you want to stay in that position, may challenge you, or you're going to be consistently switching. So I may take 3 steps. I might switch. I might switch. I might switch. I might go the other way. So the goal is to be able to go between very distinct movement patterns in a relatively fluid manner. I'd maybe do this for 5 minutes on a treadmill, not extensive, there's no need, but this would be a nice coordination, very high level balance drill. I hope you enjoy. Come see us if you need help.